bit her tongue or something while she was eating. So I just comforted her, and she stopped crying and then went on to finish her lunch. So I didn't think anything of it. And then for the next couple days, it happened again when she was eating. And I thought, well, maybe she, bit the inside of her cheek and she's just kind of rebiting it, or that maybe the food is burning her cheek or something.
But over the next several weeks, Emily continued to experience painful episodes.
It was happening at different times, not just while she was eating, but maybe while she was drinking something through a straw, or in the bathtub. If she was getting water splashed on her face, she would start to cry.
We would console and help her through the period, which would often only last a few seconds.
The first time that I became aware of anything bothering Emily was when her mother and I were talking on the telephone. Emily was in the bathtub, and I heard Emily screaming in the background, and Laurel said, "Just a moment, Mom." Laurel came back to the phone and said, "Well, gee, that was strange, but she must have bitten her cheek."
I remember being in the room on one of my visits, and her crying out and putting her hand to her face, and Lori said, "Oh, honey, did you bite your cheek again?" And Emily would nod yes. I think she just didn't understand what her mommy was asking her. All she knew is that she had pain, and her mother was acknowledging that she had pain. And Lori said, she keeps biting her cheek. I don't know what to think about it. It's very strange. She keeps doing it.
I would look inside to see if there was a sore on her tongue, or if there was something on her cheek that you could see, and there was never anything there.
Thinking it might be a toothache, Laurel took Emily to the dentist. But after a full exam, the dentist found nothing out of the ordinary.
I'd asked him, well, should we do x-rays to make sure? And he said no. He said he didn't need to because he could see that her teeth were fine. He said that if she had a cavity that was bad enough to be causing pain, that he would be able to see it, and he couldn't. So we kind of went away with no answer.
I think Laurel may have thought that there's something more going on than myself. I just tended to think, well, she's biting her tongue, or it's going to pass. I think that's a lot of fathers' attitudes with a lot of things, is it's going to pass. We don't need to do anything.
But as the months passed, Emily's mysterious episodes began erupting with increasing intensity. Laurel was getting scared.
She would have episodes when we were changing her clothes, like pulling her shirt up over her head, or if the wind would blow her hair against her face, or if she was just running sometimes and just her body jostling as she ran, she would just stop short and start to cry.
We never saw any warnings. It would just happen. The pain would just start instantly, and it was intense instantly.
Her whole body would shake. She would like convulse, and then she'd start to cry, and she'd put her hand up to her mouth.
She'd go like this, and her hand would bounce. I remember because she wanted to put her hand on her face, but she didn't dare put her hand on her face. And she'd be like, and then it'd be gone, and then she'd stop. And she'd talk like this. It was very sad.
When the pain subsided, she would resume whatever was going on before it started.
We were just stumped. I mean, we would talk to each other and say, well, what if it's this, or what if it's that? It was just confusion. We didn't know what to think.
Frustrated and lost, Laurel decided to take Emily to a new pediatrician.
And of course, Emily was fine during the doctor's visit. She had no symptoms. She was happy-go-lucky. Everything was great. And so the only thing the pediatrician had to go on was what I was telling her. And the only thing she could think of was that maybe Emily had stones in her salivary gland, which I had never heard of, but she said that you can get stones there just like you do in your gallbladder, and that it's very painful.
The pediatrician referred them to an ear, nose, and throat specialist.
He did a visual exam of her face and looked inside her mouth and felt around her cheek and said that she didn't have stones, and that he didn't really have any idea what it could be. I knew there was a problem, and it just didn't feel like I was getting a response.
Then, to Laurel and Dave's surprise, the pain went away for a few weeks. But by the time Emily turned 4, it was back again with a vengeance.
The pain episodes became much longer in length. Initially, they were a couple seconds typically, and they were now approaching maybe 10 to 15 seconds.
It was like she was being struck with electricity. You'd see her body and her face starting to shake, and her eyes would get real big, and you knew that it was coming. But she didn't want you to touch her. She would push you away
Soon, Emily began to develop tactics for coping with her pain.
She would stop playing and sit down and just sit on the couch, kind of still and quiet, which is not like her at all. So we would know when she was having a bad day because she would be kind of not herself, almost kind of zombie-ish.
She couldn't even open her lips wide enough to get a tiny little baby spoon in with some applesauce. She just couldn't do it. She went like this, you know, and it wasn't worth it to her to eat out. She's starving. You could see it in her eyes. She was starving. She was so hungry, but it wasn't worth it to her.
We wanted so badly to get rid of the pain, and again, being helpless. Nothing we could do seemed to work.
They were exhausted. They were tired. They're just two normal parents trying to figure out why their daughter was screaming. They didn't know. None of us knew.
I was sort of in a state of panic by then. The pain was so severe by now that she wasn't just crying, she was screaming. So much that she lost her voice. So she was screaming and nothing was coming out. It was just horrific.
Since the age of 2, Laurel and Dave Garland's daughter Emily has been experiencing mysterious episodes of pain in her cheek. Now at age 4, Emily's condition is getting worse, and the Garlands are at their wits' end. Hoping for an answer, they take Emily back to the pediatrician, but instead of a diagnosis, they get a surprise.
She said that she thought that maybe Emily was faking it to get attention.
It was discouraging at first, but it sounded like as real of a possibility as any other possibility we'd been given.
And Emily always likes to be the center of attention, so it wasn't that far-fetched to us.
So Laurel and Dave tried to break Emily of what they thought might just be a ploy for attention.
So what we did for several weeks was we would ignore it when she would start to cry. If she would tell us, my cheek's hurting, we would say, no, the doctor said there's nothing wrong with your cheek.
But then something happened that told the Garlands that it was real.
She started waking up in the middle of the night, crying.
Little girl looking for attention is not going to scream out in the middle of the night. It didn't make sense. It didn't make any sense at all.
Laurel and I decided this is not a kid who's looking for mom and dad to come rub their back.
When we realized that she wasn't faking it and that we had treated her that way for so long, it was just a horrible feeling of guilt.
Lori said, I can't believe that I punished her for having that cheek pain. She goes, I don't think I'll ever forgive myself for that.
Desperate, Laurel was ready to try anything.
I was kind of at the end of my rope. I didn't know who to take her to, so I just opened up the yellow pages and looked for a pediatric dentist, and that's where I took her, and that was Dr. Hishaw.
When I came in and saw Emily, Laurel was standing by her, coaxing her just to, sit in the chair, but she was very delightful. She wasn't running around all over the place. Laurel was just wanting to find out what was the cause. She was still very calm, but you could sense the anxiousness in her.
She was great with Emily. She has such a sunny personality, and she's great with kids. She was sort of the first doctor who really sort of committed to helping us find out what was going on.
Starting at the beginning, Laurel walked Dr. Hishaw through all the strange symptoms Emily had experienced over the past 2 years.
What was going through my head was, this is something that is not dental related, but the description of the sharp pain on one side of the cheek, my thoughts were going to that this must be neurological in origin. My theory was that this could be trigeminal neuralgia. The only thing was she was a 4-year-old child, and this is just very uncommon.
And I'd never heard of that before, and I said, what did you say?
Trigeminal neuralgia, or TN, is a disorder that doctors believe is triggered by the compression of the trigeminal nerve located in the brain. When the nerve is compressed, it sends bolts of intense electric shock-like pain into the face, where the branches of the nerve extend.
Immediately, Dr. Hishaw said, she mentioned the words research, she mentioned let me get back to you. She didn't have an answer right there, but she was the first person that said we need to figure out what's going on here. And that, at that point, was awesome, was incredible. I remember feeling very relieved just to hear something mentioned as far as a specific condition.
They had this huge sense of relief that they had finally found somebody who cared, somebody who actually could possibly have a diagnosis.
It didn't fit the parameters of a patient who should have trigeminal neuralgia, but it was my best guess, and I just wanted someone who was specialized in that field to do the further test.
Dr. Hishaw recommended they take Emily to Dr. Abhay Sanan, a neurosurgeon who specializes in TN.
Trigeminal neuralgia is a very painful disorder. It is so painful that there have been reports of patients being driven to suicide because of the pain that it generated.
Dr. Sanin immediately ran a series of tests to determine if Emily had this rare disorder. The results were shocking.
Emily is the first child that I've seen carrying the diagnosis of trigeminal neuralgia, and it is possible that I may go my entire career without seeing another case in a child as young as hers.
I was very relieved because we had found something. There was something there, and so we were treating it. It felt like finally we're doing something to help her.
To relieve Emily's pain, Dr. Sanin prescribed an anti-seizure medication, usually used by adults. For this little girl, the treatment is not without danger.
The anti-seizure medicine does carry risk. The rarer side effects could include liver damage, and that's why we have to check liver function tests in patients that are on this medicine.
But for the Garlands, it was well worth the risk.
I gave Emily her first dose in the car as we were driving away from the pharmacy.
Almost instantly, Emily was back. Her personality was back, and the pain was gone almost instantly.
I felt so happy and relieved, and it was just finally over.
TN is treatable but not curable. Emily will be living with it for the rest of her life.
Trigeminal neuralgia is a benign condition in the sense that this is not cancer, this is not something that necessarily threatens life or limb. So her prognosis from that perspective is excellent. However, her prognosis that she'll live an entirely pain-free life is uncertain, and that only time will tell.
We're actually lucky that she got diagnosed so soon because many people suffer for years and years. I've met people who suffered with it for 10 years and never got a diagnosis.
With the proper diagnosis, Emily was finally given her childhood back.
And I just remember one day just sitting there and I just kissed this cheek over and over and over and over because it was like I couldn't kiss that side of her face for 2 years, and it was like I need to get caught up over here. So I just remember kissing her over and over. And she was like, "Oh, Mom."
Emily Garland's rare and painful disorder struck when she was just a toddler. But Ashley Tabling's problems didn't start